Good morning, friends. This is a very short talk with illustrative videos about the gravity method of reduction of hip dislocations. Dislocations can happen in normal hips or post THR hips. In normal hips, the forces needed are very high and in complex positions. For example, a person is driving a car which has a head-on collision, the impact is on the knee which pushes back the head and maybe even accompanied by an acetabular fracture or a flake. Or somebody falls from a trampoline where the leg is stuck in one position, the whole body twists around, falling from a height. The forces are very, very large and either accidents or sports. On the contrary, a replaced hip is much easier to dislocate because surgical trauma cuts off tissues and loose hip in the immediate post-op period, which will tighten up soon. And of course, we see situations where with dashboard injuries, we have fractured shaft of the femur and the dislocated hip together. These scenarios are not very rare. Every orthopedic surgeon faces this situation, and in many times they rush to open and reduce. This talk is going to tell you that 97% of hip dislocations can be reduced closed, whether it is a traumatic dislocation of normal hip or a dislocation of a replaced hip. In short, in this short video, I will be describing the gravity method of hip reduction, which has been developed by me over many years. The patient can be either on the bed or on the floor. The hip and knee are both flexed to 90 degrees each. So, it has to be 90-90. With a full flexed knee, the surgeon lifts the patient off the floor or bed. So, if the patient is on the floor, surgeon bends down, keeps the limb on its shoulder and he raises up. If the patient is on a bed, you hold it and pull the leg and you lift the patient. The buttock of the dislocated side must be few inches above the bed or floor. And the leg has to be held in this position to allow gravity to use body weight to produce counter traction. So, as we keep holding it, counter traction is applied by the gravity and the person's weight is exactly the same amount needed to reduce the hip. Using the flexed leg as a lever arm, hip is circumducted and extended as the head glides in. You will see in this video, it is a post THR dislocation and I am holding it, raising it, circumducting it, and despite being such an obese lady, the hip is reduced. And this is the post and pre and post reduction x-rays. We can see that it has gone in rather easily. This is a case of a traumatic dislocation who already had an amputation due to an accident, and here he is reduced on the floor or stretcher. You can see that the knee is flexed, hip is flexed, and using the leg as a fulcrum, it is raised till the hip raises out of the bed. And the hip gets reduced. So, irrespective of whether it is traumatic or it's a post operative, you can see the reduced hip along with the flake of the sternum, which is extra articular and has been left alone and the patient is doing well. If you are interested in biological methods of fracture management, IAOS has a 4-month online fellowship and course. You can always WhatsApp message me on 9791020615 and I will send you the details of the course. And next time you get a patient of dislocated hip, just refresh this video and you will be able to reduce the hip easily. Thank you very much. Have a nice day. Thank you.